Right now, schools are debating whether to bring students back in the fall. Businesses that have relied on office spaces continue to have them work at home.
A case in point, our newsroom, which in the middle of the day had 4 people in it today. One of them shot this video. Most of the news team is still working from the field or from home. And even in the office, we have to take precautions since evidence is showing that COVID can pass from person to person through tiny droplets exhaled and sent into the air.
Masks are the first line of defense. But what if your building's air filtration system could trap airborne bacteria and viruses before they can infect anyone else? News Center Maine's Vivian Lee is here to tell us more about this University of Maine project, which is borrowing a concept from nature. Viv?
That's right, Pat. The pitcher plant uses a liquid membrane to trap insects, and University of Maine researchers have successfully used this idea to capture bacteria. Now, thanks to nearly $250,000 grant, this technology will soon be tested on the pathogens that cause COVID. It's a burning question for scientists everywhere.
Do the droplets in the air with the virus have infectious virus, or is the virus been deactivated and it's no longer able to infect a person?
Caitlin Howell is a biomedical engineer at the University of Maine. Right now, she says it's very difficult to collect a large number of intact virus particles out of the air. But Howell and researchers from the University of Massachusetts Amherst believe they found a way by borrowing an idea from nature.
The pitcher plant uses a thin layer of liquid on the surface of the rim of the plant to get ants and other insects to slide into the cup where they're digested.
The concept has also been used by researchers at Harvard. Prior to the pandemic, researchers in Maine and Massachusetts developed a coated membrane that can be used in an air filtration system, which allows collected bacteria to be tested.
So when we have the pressure on and we're actively filtering things, that liquid is moving out of the way, but is still there so it can capture what tries to move through those pores.
The coated filters were 32% more effective in capturing live bacteria than large commercial filtration systems. So thanks to a $225,000 grant from the National Science Foundation, researchers along with UMaine virologist Melissa McGinnis will use the membrane technology to try to capture the virus that causes COVID.
We want to be able to build a system that is cheap and widely available, that we can just slide into air filters that exist everywhere and that can be continuously running to collect these pathogens so that we can always be monitoring this.
Oh, okay, so she should be pulling it.
Now, researchers will begin testing the membrane with the activated COVID virus next month. And the hope is one day these membrane inserts could be used in doctors' offices, hospitals, nursing homes, or even indoor spaces where it may be hard to socially distance, not just for COVID, but for other viruses as well, including the flu. Pretty exciting. Back to you, Pat and Cindy.